Health Informatics B644. This is week 2, module 2. We'll be discussing the history and the present state of consumer health and informatics with respect to incentives and barriers, basically the legal and regulatory environment. Now, before we jump into this, let me say I'm behind. Today is January 29th, and this is only week 2, so we should be coming up now. This should be the end of week 3, and week 4, of course, starts Monday morning, let's say. So my intent is to finish this today and to finish the next week so that by Tuesday, January 31st, I want us to be caught up with all of these videos. Now, the good news is you can watch them and consume them at your own pace. And hopefully we'll be able to stick to these being primarily 10-minute kind of videos. We'll call today another learning step in that process, somewhere between 8 and 15 minutes. Let's say we'll try to generally target, depending on the topic. The topic dictates how long we need to cover. So this is week 2, and we've got 5 lessons or lectures that will be included in this week's series. Today, this one is setting the stage. After that, we'll go to reflections and reflections on legislation and regulation from 2000 to 2016. After that, for the last 3 lessons of this module, we'll focus on the Cures Act, which sets the environment that we live in today. So lesson 1, setting the stage. You know, we call it consumer health informatics. I'm not sure quite how I would define that anyway, but there are a bunch of other terms. Mobile health apps are certainly a subset of consumer health informatics. Personal health records, which are past their heyday now, may make a resurgence, was one approach to consumer health informatics. E-health, digital health. I struggle with both of those terms. For a time, they had fairly reasonable meanings, but now they've become so co-opted, so general that I don't tend to use them. I'm not sure what value they bring in terms of the precision of the ideas they convey. Something new, digital therapeutics and software as a medical device. So as we go through the semester, we're working towards a better understanding of how software technology, what we think of as that universe of consumer health informatics, can translate directly into digital therapeutics and software as a medical device. But that's not for today. And of course, I should note, there are probably a dozen more names that one could use that we'll hear and perhaps encounter even through the course of this class. I wanted to spend a couple of slides framing the overview to how consumer health informatics, whatever we call it, digital health, fits into the larger healthcare landscape. So I've got a 4-quadrant system here. On the vertical axis, we've got the administration kind of functions, and above that, therapeutic kinds of functions. So I'm focusing on functions or interventions rather than diagnoses or health conditions. And of course, on the x-axis, the horizontal, I'm trying to distinguish between behavioral things and non-behavioral things. So let's see if we can't figure that out a little bit and then see where consumer health informatics fits into it. Obviously, the administrative stuff covers everything. It's the overarching administrative set of stuff with scheduling and checking in and managing prescriptions, bill payment, capturing history, all that kind of stuff. When we look at behavioral, non-behavioral, I'm thinking here of interventions that are by definition today performed, if not exclusively, certainly primarily, by clinical staff. So surgery, medications, physical therapy, x-rays, just to kind of illustrate the few things, the range of what clinicians do that we think of as healthcare, that they do to us in our bodies, for example, is what I think of as non-behavioral. And when I think of as behavioral, I'm thinking of things that relate to what influences and what do we do through our behaviors that might affect health. So that might be simply gaining proper information to inform what it is we do and how we live. It might be peer support. It might be status reporting. How is your pain level today? How are you reacting to the drug? How is your recovery from the surgery going? And significantly, it might include what we call behavioral medicine. Now, I'm distinguishing here between behavioral medicine and mental health or mental well-being. Behavioral medicine or mental health or mental well-being refer to what we expect it to. Mental state, certainly addiction falls within that. And that fits within, to some degree, this behavioral bucket. But that's not the idea I want to get to mostly. There may be non-behavioral aspects to the treatment of addiction or mental illness, such as pharmaceuticals and such. But what I want to get to here in the behavioral side is how we behave that affects our mental or physical health. And that's called behavioral medicine. That's exercise, diet, all the ways we live. And then when we say if that's behavioral versus non-behavioral or interventionist, then where does consumer health informatics fit in? And I think it fits in right about here. It's mostly trying to influence behaviors. What do we do with respect to our health? But there's some overlap, obviously, into the administrative stuff that we might do through a patient portal, or even into the non-behavioral stuff, at least to the extent that we are giving status updates or information that affects how the non-behavioral interventions might proceed. And so it includes, among other things, research, certainly. It includes patient adherence, regardless of the nature of the condition or the long-term therapy. Patient adherence to what they're supposed to do matters a huge amount. And of course, policy advocacy. How do patients use their own community and perhaps use consumer health informatics to influence and shape policy, whether it's through evidence-based practice, that is to say, the understanding of what works and what doesn't, or whether it's through more of a political kind of a frame of reference. Now, another way to look at this is to think about it as having two spheres initially. One is the consumer health informatics part of an electronic health record? Now, whatever is developed independently will certainly be copied, cloned, incorporated, bought into an electronic health record. They're the kind of the gorilla in the room of healthcare IT. And so, or are the interventions that we're talking about, the consumer health informatics applications, are they independent of the EHR? Do they exist for the benefit of the patient, but are not connected to the electronic health record? We call those freely spinning wheels. They're out there doing their thing, but they're not connected to the healthcare system. They're not connected to a health information exchange or the healthcare electronic health record. And of course, there's the bucket that we will certainly be thinking a lot about, which is right here, where we're talking about what we might call not a freely spinning wheel, but a great application that exists outside of an electronic health record, but is integrated to the electronic health record, either directly or through a health information exchange. Now, a quick comment about Microsoft. The version I'm using still doesn't like me to type in EHR, and autocorrect wants to make it HER instead of EHR. So if you see HER as here, clearly I messed up and I typed it incorrectly. It changed it back and I wasn't able to force it to have the right 3 letters in there. So that'll be our understanding that if you see HER, I'm probably meaning EHR. So let's talk about the perceived barriers. I'm just going to list all these guys. Why people have said the progress towards consumer health informatics thus far has frankly been slow and has not been consistent with any other industry, whether it's retail or whether it's financial services or whether it's just about anything but health. We have lagged behind. And the reasons we see are all listed right here. I'm not going to, you can read them perfectly well. Lack of standards, security and privacy, competitive silos that separate these things, lack of trust unfunded mandates, decreases in efficiency. I think as a whole, this stuff is kind of baloney. It's they're excuses, but that can be overcome. Now, having said that, I'm going to show what I think are the top real barriers, and they include some of those we just saw. So I'm not totally dismissing the earlier set. They're repeated here. This is the key point, though. We certainly have broken funding and incentives. If providers don't get paid to collaborate with consumer health informatics, it simply isn't going to happen. If there isn't some incentive, some reward, and also an absence of competition, there haven't been consumer health applications that compete with traditional health in such a way as to justify and mandate their existence independent of funding and incentives. A lot of resistance to change in the healthcare industry, perhaps more than other industries. If it's a clinical kind of an innovation, great. If it's technology that doesn't involve them delivering the care, there's a lot of resistance, uncertainty, and conflicting regulations. All of this, in my mind, really reduces to one thing: policy failures. And that's what we're going to talk about now. Actually, that's what we're going to talk about in the next lesson, lesson 2.